Hello, everybody. A warm welcome to all. Myself, Shamika Desai. I am lactation educator at Curie Hospital, practicing here from past 3 years. Today, being it's in a breastfeeding week, we all want our mothers or would-be mothers to breastfeed their babies and have a successful lactation journey, to have more inputs and to have more knowledge about what is breastfeeding, how one can achieve it. Let's highlight few points and be more interactive. When we say breastfeeding, okay, remember this, we all are mammals, we all are humans, and all humans can manage breastfeeding. There is no mammal in this world who cannot do breastfeeding. So if you encourage from your side, the baby will definitely latch and you will be successful in your journey. There are different types when it comes to breast milk. The first which comes which gold for the baby, that is cholesterol. It is highly nutritious. It helps you to improve your immunity. Next comes the transitional milk. Transitional milk is more of watery. Okay, so it's like a soup for the baby. It is very important for the baby as well because it helps the baby to digest the milk what is as per his gestational age. Next comes that is your matured milk. Okay, in matured milk, which is actually white in color, the first which comes in the matured milk is the fore milk and then comes the hind milk. Fore milk is more of water and hind milk is that is actual milk. When we talk about breastfeeding, okay, you have to remember that you have to latch the baby. When the baby latches, it gives the signal to the brain that I want to produce more. So जो भी खाते हो उससे फर्क नहीं पड़ता, बेबी ने लैच करना उतना ही ज़रूरी है. So this is what the physiology of the breastfeeding is, that you have to make sure that your baby is latched well. When the baby is latched, it gives the signal to the pituitary, it gives the signals to produce more hormones, which helps you to produce more breast milk. Okay? मेरे पास आने वाली हर माँ बोलती है मेरा दूध बच्चे के लिए इनफ है कि नहीं. तो इतना जान लो, शुरुआत की 24 से 48 आवर्स तक बच्चे को ज़्यादा दूध की रिक्वायरमेंट नहीं होती, उसका गट कैपेसिटी कम होता है. जैसे बच्चा बढ़ता है वैसे उसकी गट कैपेसिटी बढ़ने लगती है. उसको हार्डली एक मटर जितना दूध लगता है ऑन द डे 1. सो इवन इफ यू प्रोड्यूसिंग लेस, it doesn't matter, just focus on breastfeeding. Okay, when we talk about position of feeding, okay, remember there are various positions where the mother can feed. The most common one is the clutch hold method. Okay, in clutch hold method the baby is resting in your elbow, the gap between your elbow, okay, whereas the whole hand holds the baby's shoulder, bum and the back, whereas other hand is used for the giving the position. Okay, this is very common method of feeding. Here the baby and the mother are close to each other. Here the baby is there is more of skin to skin which occurs, and it is very comfortable for the mothers to feed. The next position is the cross cradle hold. Cross cradle hold means जिसमें उल्टा हाथ और उल्टी छाती होती है. Okay, in the first position the same hand and the same breast is there. In the next position opposite hand and the opposite breast is there. Here you hold the baby's neck with the thumb and the middle finger. The index finger holds the baby's head. The full hand holds the baby's shoulder, back and bum, whereas with the other hand you hold your breast. Here also mommy can see that the baby is latching well or not. The third method is called the football hold or clutch hold method. Here this is very good for twin mothers, for small babies and the mothers who have undergone C-section. Here the mother holds the baby like a clutcher, okay, where you have to make sure that the position pillows are arranged so that the baby doesn't go down, okay, and with the other hand you can hold the baby mother's breast and you can feed the baby. The next position is the supine position or sideline position. Here the mother and the baby is sleeping, okay, slantly tummy to tummy tucking takes place and the mother can latch the baby. We don't recommend more of the supine positions. The reason, there is more chances of going for accidents. But yes, if the mother is very tired, if the mother has spinal headache, we can definitely go for this. Okay. Now how we will come to know whether it is the latch is correct or not? You have to always remember, whenever you are latching your baby should hold not just the nipple but also the areola. Okay. More the black portion inside the baby's mouth, better will be the milk supply, better will be the latch. Okay. You should not have pain while you are latching. Remember this. Okay. The baby's ears should move while they are latching. Okay. You should be able to see that the lip is flipped out. Okay. Soft cheeks should be there. And the baby should be very relaxed. These are the few signs to understand whether the baby is latching properly or not. If there is incorrect latch, there is definitely going to be a pain in a baby. Okay, the baby might move the nose here, might be sucking the nose, kind of thing he might be doing. Okay, his mouth will be this way, which indicates that the baby is not latching properly. He is only holding the nipple. If the baby's mouth is full, that indicates that the baby is latching properly. Okay, gulping down properly. Okay, there is a little or no swallow. There should be swallowing which must be taken place. Okay, and if the baby is not wetting the diapers, or if the baby is not passing enough urine, that is also indication that the mother is not getting enough milk. There is weight loss which is happening. That indicates that the mother is not getting enough milk or the baby is not latching properly. Okay. Always remember that the baby doesn't cry only for food. Sometimes baby cries for many other reasons. Okay. He might cry because of pain. He might cry because of he is feeling cold, etc. So if the baby is crying for food, okay, you don't wait till the baby is very cranky. Otherwise he won't suck properly or he will get irritated. Try to find the early signs of hunger. When the baby is putting mouth in his hand, when the baby is at mother frequently, okay, the baby is trying to eat his shirt or his dress, that indicates that the baby is hungry. Get the baby close to you, make him latch. The latch will be proper. But when an irritated baby or when a cranky baby, always make him or her calm and then try for feeding. Otherwise the baby might have issues of not agree for latching or might not agree for breastfeeding. There are also various maternal challenges which are there while breastfeeding. Few of the challenges are flat nipples, inverted nipples. Okay, so in the picture below you can see that there is a nipple which is normal, there is a nipple which is flattened and the nipple which is inverted. Okay, all mothers, even inverted mothers, can even breastfeed the baby. Okay, we have different techniques, we have pullers available which helps your nipple to come out. More the baby latches, okay, better will be the milk supply. And always remember, it's not just the nipple that the baby should latch. Baby should latch the areola. So offer the areola more if you have issues of any nipple inconvenience. There are few issues also which happens during breastfeeding. One is nipple sore. Nipple sore is the redness of nipple becoming red because the baby is biting the nipple and not the areola. Make sure that if these things are happening, apply ice on your nipple. Apply your own milk. Okay. And always try to feed the baby properly, always try to latch the baby properly. There is engorgement which occurs with few of the mothers. Engorgement is excess of milk production. If engorgement is not treated properly, it might cause even lumps, it might cause abscess. So make sure that you are latching the baby every 2 hours to avoid engorgement. Okay, you can massage your breast while feeding so that if you feel the lumps are happening, those lumps can get reduced. Apply ice packs, okay, so that the engorgement reduces, and offer the baby in a proper latching position. Things you have to remember while you are breastfeeding. First, you have to hydrate yourself well. The mothers who are well hydrated, who are eating well, will get a very good milk supply. So make sure that you at least land up having 4 to 5 liters of water. Include good quantity of liquids in the diet. Include galactose in the diet. Okay, there are various galactogogues available like methi, cumin, ajwain, which is available in the market. So you can go for those. Hydration is very much important. The mothers who have issues for breastfeeding, they can even go for your breast pumps to express out their milk. Always remember, when you're feeding, the first thing what you have to do is direct feeding. Breast pump is just a secondary aspect, so that if your milk secretion is more or you're having issues of engorgement, you can express out your milk. Rather than throwing it away, you can give your own milk to the baby. Okay. Second thing what you can do is your expressed milk, and if still it's not enough, then you can go for the other mother's milk if it is available. Okay. Now whenever you are talking about expressed milk, remember you can store the expressed milk for 4 hours in the room temperature. You can store in the refrigerator for 24 hours. Never heat it. Okay. Make sure that you are getting it, putting it in the double boiler. Just put it in hot water so that it comes to the normal position and you can feed it. Never use bottles for feeding the baby. Always go for spoon and katori for feeding the baby. And always remember, proper latch and proper breastfeeding, direct feeding will only solve your purpose of lactation. I wish all my female mothers who are going to become mothers soon will have a fantastic journey of lactation, and they will definitely come with smiling faces with their kids in their hand and saying that yes, I am the breastfed. I am breastfeeding mother and I breastfed my baby throughout my delivery or lactation journey. I wish you all a best of luck. I will be available with Cure daily between 9 to 2. My contact details are attached below. You can definitely come and visit me if you have any issues regarding lactation or breastfeeding. Thank you all, and happy motherhood. Take care.